For any provider to identify patients with cardiac amyloidosis as early as possible, it's important to be aware of and cognizant of extracardiac findings that may occur years or even decades before patients present with cardiac symptoms. As a cardiologist, I've now routinely asked patients about things such as carpal tunnel syndrome, tendon ruptures, large joint arthritis. These findings are especially prevalent in patients with wild-type TTR amyloidosis and some more common variants of hereditary TTR, including the V142I mutation. Asking about or ascertaining a history on orthopedic and neuropathic symptoms in patients with any of the cardiovascular symptoms of amyloid can lead to an early evaluation and diagnosis, and most importantly, early initiation of treatment.
Indication and important safety information. Indication. Attruby, acoramidis, is indicated for the treatment of cardiomyopathy of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults to reduce cardiovascular mortality and cardiovascular-related hospitalization. Important safety information. Adverse reactions. Diarrhea 11.6% versus 7.6%, and upper abdominal pain 5.5% versus 1.4% were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests. Mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter, and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations. Pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk, or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.